Today we're going to talk about something called aphasia. And aphasia is a condition that people can have when they have a sudden loss of language function. And usually this is due to some kind of brain damage. And I want to say that this brain damage generally tends to happen on the left side. And why is that? It's because if these people are losing language function, then it just so happens that for the majority of folks, the language control centers are really on the left side of the brain predominantly. So before we kind of delve into the different kinds of aphasias that there might be, we have to first look at the anatomy of the brain itself. So let me draw a little representation for you, and I'll try to label it to the best of my ability so we can really understand where we are. So let's say that we're looking at the left side of the brain right now, and this is the front, and this is the back of the brain, okay? So right here we have what you might know as the frontal region or frontal lobe. Here all the way in the back we might have the occipital lobe. We have the temporal lobe down here to the side, and over here we have the parietal lobe. So I've just labeled that F, P, O, and T to kind of tell you what that means. Now there are a few key areas that I want to highlight in this brain anatomy that I think are going to be really important to understanding where speech comes from, how it's understood, and how the response is created. And this, lesions or injuries in these areas are what's going to lead to aphasia. So the very first is this area located right around here, sort of in the superior temporal region, and this is called Wernicke's area. Now, Wernicke's area is responsible for speech comprehension. So as I am saying everything in this video, you're probably using your Wernicke's area to really comprehend or understand what I am trying to say. Then you have the second area right here in the inferior frontal region, and this right here is called your Broca's area. And Broca's area does something different. Wernicke's is responsible for comprehension, whereas Broca's is really responsible for speech generation. And I want you to think of this more as a motor function. So everything that requires actual movement in generating speech is what Broca's area is really responsible for. And in between, you have this group of fibers, kind of in this red, and these are going to be something called the arcuate fasciculus, and as you can tell, they're actually connecting Wernicke's area to Broca's area. So what this kind of tells us is that there's a few steps responsible in understanding speech. First, you have to actually understand that speech, and remember I said that that is where Wernicke's area comes in. Then everything that you've understood through Wernicke's travels through the arcuate fasciculus, I'm just going to say AF, and it reaches Broca's area where you can actually generate a response. And again, that is where Broca's comes in. Now, one of these three areas can be damaged at times, and when that damage occurs, that leads to three very distinct types of aphasia that we're going to learn about now. So you're probably wondering, well, what can damage the brain in these areas? And it can really be anything. It can be some kind of trauma, like a car accident. It can be a stroke that can really damage one of the arteries that supplies the blood to that area of the brain. There's a lot of different things that can go wrong and then can lead to these symptoms. So let's discuss three different types of aphasias. And while we discuss it, I'm going to kind of create a table, and I'll also say location of damage. And remember, we have three different parts to speech, right? We have understanding, so I'm going to say comprehension. Then we have the traveling through the arcuate fasciculus, and then we have the actual generation of the response. Okay, so let's start off with something called Broca's aphasia. And Broca's aphasia, as the name implies, is definitely a damage in the Broca's area of the brain. So it's this area right up here. That's Broca's area. And what happens is, remember, Broca's area is responsible for speech generation, not comprehension. So your comprehension is going to be okay. However, and actually, in fact, everything that travels through the arcuate fasciculus is also going to be okay. But you will not have this response that that can be generated because Broca's area is responsible for speech generation. So you're not going to be able to actually say anything out. Your speech output is non-fluent. And what's really interesting here is that patient seems to be aware of the problem and often appears distressed. So that's a really interesting clinical phenomenon that tends to show up. Okay, the next type we have Wernicke's aphasia. It's a similar concept here. The area that's damaged is, of course, Wernicke's area. And remember, Wernicke's is responsible for comprehension, so your comprehension is not going to be okay. This person is going to be unable to understand very many things that people are saying to them. However, the fibers that travel through to the arcuate fasciculus may be fine, and the response is actually also going to be fine. So this person would tend to be, unfamiliar with anything you might be saying to them, but they might still be able to speak okay, so they can probably guess what you're saying and respond, and it might seem like they don't have a problem at all. So you really, as a doctor, would have to understand and be able to detect these signs and the little differences between them to determine what kind of aphasia a person might have. So you really have to think about comprehension and response as two different things and be able to judge that. And remember how I said in Broca's area, the patient is going to be aware of the problem and is going to be really distressed. In Wernicke's, the patient is, weirdly enough, kind of unaware of the problem and seems quite cheerful, actually. So that is a great way to distinguish between the two. And the third one sort of involves both. So this one is called conduction aphasia. And that's going to have some kind of damage, probably somewhere in the arcuate fasciculus, because that's what connects the two. So if you think about it, let's go back to this diagram over here. If you have a damage anywhere in these red fibers, technically your Wernicke's area is okay. Therefore, your comprehension might be just fine. However, you're obviously going to have problems traveling through your arcuate fasciculus, so this is not going to be okay. And your response, similarly, because it's not going to receive any response to the Broca's area will not be able to generate any speech. So your response is also not going to be okay. And in conduction aphasia, this one's interesting because you can also, what's interesting is patients will come in and weirdly enough, they will be unable to write, and they will be unable to read and recognize words. So this is called agraphia with alexia. Agraphia is inability to write, and alexia is inability to read and recognize words. So these patients will tend to have this interesting symptom as well. So of course, as a clinician, it is your job to decide which symptoms the patient has and really be able to distinguish these different symptoms and figure out what type of aphasia the person might be coming in with. All right, that was the end of this video, and we hope you learned something.